My name is Jana Bitton. I'm with the Oregon Center for Nursing. I'm pleased to introduce our research director, Rick Allgeyer, who's going to share a little bit about our report on a new view on nurse turnover and how the COVID-19 pandemic shocked the system. I think this is really important information. We're going to have just a short session on this today. The report is available on our website, but this will be an opportunity for you to ask some questions. We'll see where it goes. So Rick, I'll go ahead and turn it over to you.
Cool, thank you. Good morning, everyone. Thanks for joining us this morning while we talk about this. I'm sure everyone has seen, if you're reading the news, if you're listening to reading or listening to the news, I'm sure you're hearing some of this about people leaving their jobs. And so I wanted to give some ideas about what's going on and why are people leaving their jobs in droves. It includes nurses, but it includes everyone else. So let's just get started on it. So we know that turnover, especially among the nursing workforce, is a global issue. It has a significant impact on our ability to deliver high quality care. It impacts the financial performance of healthcare systems, and turnover is really expensive. Most of the estimates that we see run in the $11,000 to $15,000 range per vacancy. That only includes the cost of recruiting and training new employees. But in reality, when you include all costs, which includes patient diversion, loss of productivity amongst remaining staff, vacancy costs or turnover costs jump dramatically, up to about $88,000 per vacancy when everything is included. Just a housekeeping issue, the references that you see at the bottom are all listed in the report, and so you can go there and look at the original research if you're interested. Typically, when people looked at when people looked at models to predict turnover, they really focused on a few things, which is job and pay satisfaction and commitment to the organization. And while these effects were significantly statistically significant, they really didn't account for a whole lot of, they only accounted for a very small percentage of the turnover. And so researchers began looking in the early 2000s at other models that were better predictors of turnover. And so in 2001, Mitchell and some of his colleagues came up with a model that they talked about as job embeddedness. And what it is, it's based off a psychological idea that people have a worldview that is theirs. And it incorporates or encapsulates their entire view of the world. And so what they did is they broke down this view of turnover in terms of basically three constructs. The first is fit. And that is, how does your employer or your community, because in their models, it's both, it's not just employee-centric or employer-centric or organization-centric, it's the organization and the community in which you work. And so the first construct is fit, and that is how the degree to which the organization and the community in which you live fit into other or similar to other aspects in your life, or how they align with your personal philosophy. The second construct is links, and that is the connections that you make with people at work and people within your community, and also your linkages within the institution and the community at large. And the last construct they came up with was sacrifice, and that looks at the idea of what you lose if you break some of those connections. And so what it's basically asking, what would you give up if you left? And so all three of these dimensions look at both, are related back to the employee or the employer and the community in which you live. See if that works better. So in that idea that there's these three constructs that are causing turnover, they came up with an idea a few years later, and this is, again, Mitchell, it's his colleagues, came up with an idea that there are some precipitating effects, because they noticed that sometimes individuals who claimed that they really liked their job, they were very satisfied with where they worked, left. And so they were trying to be able to explain that, and they found out that it actually occurs a lot more often than people thought. that these shocks cause voluntary turnover much more often than job dissatisfaction. And they didn't really understand, none of the models were able to predict this at all. And it turns out that this causes a lot more turnover. And so what they described is these shocks, or these precipitating effects or events that impact your embeddedness. And they can affect one or more of those three dimensions. Shocks can be expected or surprising. They can also affect one's personal or professional life. And shocks can also violate a person's image of fit within the organization or the community, or causes people to reassess their perceived alignment. And let me give you a couple examples of this. So your partner gets a job in another state. You're really happy with your job, but your partner's going. They're going to this other state. So you have to make a decision. Are you going to stay in your job, or are you going to leave to be with your partner? Well, most people would leave. So even though you're really happy with your job, traditional models wouldn't predict that you would leave because of your partner's transfer. The way that you can reassess is, say something happens at work where you get passed over for a promotion or something like that, or something at work happens that makes you reassess how you view your role or your alignment with your job. And so shocks influence the decision to leave a job because they alter the perceived sacrifice of breaking existing links, or alter the perceived philosophical alignment with an organization or community. That's just a big way of saying something happened that's making you reassess your life. When we saw these articles, the first thing that Jan and I talked about is, oh my God, this pandemic is acting just like a shock. And there's lots of evidence we'll present in a minute that this pandemic is causing people to rethink the way they are embedded in their jobs. And there's ample evidence to show that people are quitting their jobs in high numbers. That's all you have to do is pick up a newspaper and you hear articles. The phenomenon has been termed the Great Resignation. It's also been called the turnover tsunami. I like the Great Resignation because we call tsunamis everything nowadays. So the Great Resignation, it was actually coined by a professor at Texas A&M University. There's lots of evidence for the Great Resignation right now. Data from the Bureau of Labor Statistics, they have a monthly survey called the Job Openings and Labor Turnover Survey. In September, 589,000 people across the country just quit their jobs. The quits are voluntary turnover. This does not include layoffs. This does not include firings. This is people who voluntarily quit. 2.9% of the healthcare and social assistance workforce quit their jobs in 1 month. Nursing is one of the largest employers. Our largest portion of this healthcare and social assistance. All nurses make up about 33% of this economic sector. To put that in a little bit more perspective, across all industries nationwide, 4.4 million people quit their jobs in September. They just walked away. This is a nice graph that shows the quit rate and the number of quits that have happened on September of 2018, 2019, 2020, and 2021. What you can see is the jump between September 2020 and September 2021. Almost 200,000 more people quit their jobs that month. The rate jumped actually a little more than 1 full percentage point. And if you pay attention to some of this stuff where they're looking at job markets and economic indicators at the national level, a jump of 1% is a big deal. You see on the news that people are talking about a jump in gross domestic product or inflation, and they're talking tenths of a percent as being a really big deal. This is a full percentage point in a year. And you can also see that prior to the jump between 2020 and 2021, the quit rate was relatively stable relatively stable. But we also wanted to look at what was going on between 2020 and 2021. And so we actually pulled some data to look to see month over month what was going on. And what you can see is you get a little bit of a spike in April, but it's after May or June that the rate of increase really starts rising. We grew 100%. We grew from 400,000 quits in September. We jumped to 500,000 quits in April. So it took about 8 months to jump 100,000, and then we jumped 100,000 in 4 months, 5 months. So something was going on around that period, and it turns out that when you look at some of the data, this is about the time that the Delta variant took off. For instance, in early June in Oregon, 9% of the COVID cases were of the Delta variant. 1 month later, actually 3 weeks later, 63% of the COVID cases in Oregon were Delta. And a month later, August 1st, 96% of all COVID cases were Delta. So we saw this, and we remember it. I remember it. All of a sudden, the cases just took off again. And it wasn't just here, it was everywhere. If you look at CDC data, COVID, the Delta variant started really being the predominant variant sometime in the early summer. And that corresponds with this big jump in the number of quits. So it's like the COVID pandemic kind of shocked the system. And then the Delta variant just kind of pushed people over the edge. So when you ask why people are quitting, so Morning Consult has done some surveying, and they've asked people. I think we're going to put the link to this survey in the chat so y'all can look at this. This data came out 1 week after we wrote this report. So 18%. So since the pandemic started, Morning Consult asked healthcare workers whether they left their job. 18% said they'd quit. 12% said they laid off or lost a job, which means that more people are quitting that got laid off or lost a job. Among healthcare workers who stayed, about 70% said they had not considered leaving their job. 19% said they have considered leaving their job and the healthcare industry, and 12% said they considered just leaving their job for another role in healthcare. I'm going to give a little bit of a caveat to this. So when we talk about intentionality, considered is pretty much one of the lowest forms of intentionality. It means you thought about it. Now, in reality, except for me, which had never considered leaving my job, we've all kind of probably have thought about it at one point in time or another. And so it doesn't really mean anything. But what's interesting is 18% did leave their job. So a lot of people are looking at it. We've also looked at work from Gallup, and this is actually cited in our report. So according to Gallup, 48% of the American working population is actively looking for a job or passively looking for opportunities. What's really important by this statistic is it's not an industry role or a pay issue. It has nothing to do with nursing specifically. It's not an industry or role, it's a workplace issue. The highest quit rate is among workers who are not engaged. And we're going to talk about how that kind of fits in. So this is a little quote that Gallup that I thought was really, really interesting. It basically says that if your manager engages you, it's going to take a 20% pay raise to lure you away. 20% is a huge pay increase. But if you're not engaged, it takes next to nothing to post most disengaged workers, which is really interesting because what it talks about is the data from the Gallup polls are really consistent about the idea of embeddedness. They use different words. They talk about engagement, but when you look at what they talk about when they're describing engagement, they really are talking about embeddedness. They're talking about how people are linked to their job. The data suggests that the pandemic acted as a shock because most of these quits that you see in the media happened after the pandemic happened. And our data showed that you saw an increase right after when the pandemic started, but you saw a huge increase with the Delta as it got really worse, because the Delta, the peak in Delta was the highest we'd ever seen. Not every state saw it, but nationwide, that was our peak. And especially in Oregon, we had more cases during Delta than we had at any other time. But what Gallup is also finding is many employers are searching for employers who prioritize employee well-being. And employees do not appear to be satisfied with employers who treat well-being initiatives as a perk or a fringe benefit. We also had done a paper last spring where we looked at what we thought the post-pandemic concerns we would have. And one of the things that we found from that is a lot of organizations realized that their workforce is becoming burnt out. And they were instituting things like EAP or a lot of initiatives that the management staff had implemented to try and help their employees get through this rough patch of the pandemic. And when the AMN did a survey of both management staff and the employees, what they basically found was that the management staff were very happy. They thought they had done a good job providing these services to their employees. But when you ask the employees about it, yeah, they weren't very happy about it. They said, yeah, whatever, and they don't use it. So one of the takeaways from that paper was that if you're going to institute some kind of policy or implement a new program to help your employees, you really need to talk to the employees to find out what they need. When you talked about healthcare staff at the time, what they were talking about is they needed time off. They wanted time to be able to take their breaks, to get lunch, to deal with things that were important to them in their lives. They didn't want to go spend 30 minutes talking to a counselor after work hours. So what we're seeing now is that employees are really looking for employers who prioritize their well-being. The literature is also pretty clear on this, that workplace culture appears to play a major role in maintaining perceived fits and links, because that's where the employee is becoming, that's where these well-being initiatives are really taking place. It's based on the workplace culture itself. Culture is in control of the management, and the data from the Gallup polling indicates that employers can transform employee perception by focusing on business practices and day-to-day experiences. I put nurses in here, and it does pertain to nurses specifically. It also pertains to other employees. And what this means is that that management staff should focus on what can they do to make the lives of their employees easier. Don't just do things because that's the way we've always done it. Those are really toxic words when employees are searching for employees that prioritize their well-being. We're doing it this way because we've always done it that way. That's not really what people are wanting to hear, and the quit data suggests that people are leaving. And organizations should prioritize and define their workplace culture to strengthen employee engagement. And so then what you can do is then you'll find out that you'll have a workforce that's really that is very aligned with their work, with their personal philosophy of the workplace, and that it will take a great effort for them to leave. And so this is the last thing I want to leave you with. It's a quote again from the Gallup system. And it's basically one of their fine conclusions that they did. Many talented workers are leaving for the workplace to align with their personal belief system. This is really the definition of fit. That system shows an authentic concern for an employee individual well-being. People want a good life and a life well lived. What's really important here is the word authentic. If you play lip service to it, that's not going to work out good for you as an employer. You need to have a consent. And so, there's lots of polling that shows the 100 best companies to work for. And a lot of when you look into those organizations, they do have a way. It's not just having free sodas in the refrigerator or whatever. It's that the culture of the employer really does have a priority on making sure that the employees are having a good life, that the employers care about their employees, and they're not just cogs in the wheel. So while we didn't provide any concrete examples on how you can stem turnover in your organization, this gives you idea about what's causing it. If your organization is not prioritizing your employees' well-being, they'll probably leave. And I know I went through that pretty quickly, but there's a lot to talk about. So do we have any questions?
Rick, there was a question earlier in the chat from Nancy Mitchell that says, when you were talking about the quit rates, she asked, how does this compare to the 2008 economic disaster where we saw a large number of people leave their jobs? What's the difference here?
The 2008? Mm-hmm. Well, the 2008 was a recession.
Yeah.
So people weren't voluntarily quitting their jobs. They were being laid off. Mm-hmm. In reality, the major difference is the underlying causal factors. Mm-hmm. So when you're being laid off, and I haven't really looked at the data very much, I do remember the employment rate jumping very high because employers were curtailing jobs. Those people were leaving because not of their choice, but because they had lost their jobs. And those job losses were huge. We lost lots of jobs, but it was really based on economic instability. This is, even though we do have some economic instability right now, it's not the driving cost. More people are actually just quitting their jobs. And in fact, when you look at the JOLT system, which is the BLS's survey to look at its job openings and labor turnover survey, when you look at that, more people are just quitting, mm-hmm. and not necessarily being laid off or fired. Early in the pandemic, we looked exactly at nurses losing their jobs because of if you remember, they curtailed elective procedures to preserve PPE. A lot of ambulatory care services lost. They lost a lot of nurses in ambulatory care lost their jobs. That was also very temporary. They looked like they bounced back within about 3 months. So I think the difference between this and the 2008 recession was really, it's the causal factor, what caused people to lose their jobs.
Thanks, Rick. There's another question in the chat. Is there Oregon-specific data on RN turnover or current numbers projections on Oregon's nursing shortage?
No.
And that is because, yeah.
Well, it's for a lot of reasons. One is most states don't have the ability to do these kinds of surveys. Mm-hmm. The surveys that are done by the feds are usually based on samples. The two surveys I'm thinking of one is JOLTS. The other is the current population survey. And the biggest issue we run into is because Oregon is kind of a smaller state, their sample sizes aren't big enough to give us any real clue what's going on.
But eventually we will get a better idea, but it might be years from now.
Right. And the problem I think we're thinking about is it's not so much we're having a nursing shortage, is that the maldistribution we currently have, and that we've always had, of the nursing workforce is just being it's being enhanced, or it's multiplying and it's impacting different areas differently. So I just saw some data from OED, and it looks like ambulatory care is actually increasing employment. Hospitals and nursing homes are losing employment. So we're seeing a further maldistribution across practice settings that's probably being augmented or affected by the continuation of the pandemic. Most likely it's due to some constraints in the nursing homes because of all the outbreaks that happened that were nursing home specific, and also because of the long-term stress and burnout within hospitals in acute care, or nurses that work in acute care.
Great, thank you. Another question, is anyone researching the mental well-being of those voluntarily leaving, and what about those staying?
I have not seen anything talking about that right now. Most of these, the people who are leaving, this is all done on surveys, and they're not asking so much about what's going on. It's like they don't really ask for questions. They just want to make sure that they're quitting. So we really don't know a whole lot about the difference between people who are quitting and those that are leaving. But that is something that would be, it would be definitely a worth to look through some of the literature to see if they've got any ideas about it. The literature that talks about the job embeddedness, they give a lot of examples, and the problem is they're all over the place.
Yeah.
A lot of people are quitting not because of anything going on really with them, but because of their spouse or partner. Something's going on, they got transferred or whatever, so people leave their jobs for that. But what it does is it causes you to reassess the way you fit into the organization in which you work.
I think it also makes you reassess, as an organization, it makes you reassess what kind of employees you want to have.
Yes.
Because if you're fine with having employees that are not embedded, then you need to be prepared for high turnover. And maybe that's okay with you, that you just are okay with the high turnover. Right. And if you are discouraged about the turnover and you want to improve those rates, or you want to retain your staff, then there might be some other strategies to be implemented, and just understand that to create this embeddedness culture is the way that you're going to be able to keep people.
Yeah, absolutely. Absolutely. I think that as the Gallup data suggested, the culture of the organization is very, very important. And there are some industries and places, I've worked at a couple of places that turnover was expected, just because of the nature of the job. But most organizations, particularly hospitals, nursing homes, and those places, they really don't want turnover because, one, it's very expensive. It's also very disruptive.
Yeah. All right. Any other questions? If you are not already joining us, you're always welcome to join us on Fridays at 8 a.m. where we have a weekly Zoom call and a chance to talk about these and many other fundamental issues that are related to nursing and the healthcare workforce and the situation that we are all finding ourselves in now. And with that, I think we should wrap it up. Thank you, everybody. Have a wonderful Friday, a great weekend, and we hope to hear from you all soon.
Yeah, thank you very much for attending today.